call it the 360 because of all of the building blocks that go from the basic anatomy through functional anatomy to imaging to treatment modalities, and then again bringing it all together with the central piece, in this case being the neck, or the pain in the neck, if you will. A lot of courses will do a lot of didactic teaching and no real hands-on, or talk a lot about therapies, or talk a lot about imaging. This is one of the few CE opportunities that actually puts everything together in one place with a focus to be able to say you can do everything that we talked about when you go home.
My name is Troy Ford and I'm from Clovis, California. As I've been a veterinarian for almost 32 years, and the evolution of neck injuries and neck pathology has evolved to the point where I think we're missing a lot of cases because of our lack of knowledge in this area. And coming here to CSU, which I believe is one of the meccas of this type of research, I felt an unbelievable opportunity to be able to do.
4 days on the neck, just the neck, and looking at it in such detail in so many different ways, of course I'd come.
My name is Anne-Marie Wolfram, and I'm Associate Veterinarian at San Diego Equine Group, a sport horse practice outside of San Diego. I think the biggest thing for me is that I'm only 2 years out of veterinary school, and so I'm a young practitioner, and nobody treats me any differently. You know, I'm treated just the same as any other veterinarian that's here, and that was I wouldn't say pleasant. It's a pleasant surprise. It was a pleasant surprise.
The hallmark is that there's didactic teaching coupled with hands-on practical experience as well as clinical cases, and that's really what the course is all about, putting all of those modalities back together again.
A lot of times I think you think that it's going to be basic or too extreme or research based, or this has been a really exceptionally hands-on and practical meeting.
Obviously we've got the lectures, we've got the wet labs, but a lot of the things you learn are just conversations you have with fellow clinicians over a beer, over dinner, over cocktails, something like that, over a cup of coffee in the morning. I have a whole list of horses that I want to go back to and reinvestigate, follow up on, etc. So yeah, I'll put this to work immediately on Thursday morning, I'm sure.
I had a special catalog of questions concerning diagnostic imaging, and there was an interesting discussion going on my images, X-rays, nuclear scintigraphy, and CT, and I got the answers I wanted to have.
I've learned a lot more about the detail of anatomy and functional biomechanics, and now we're learning treatment modalities and therapy so I can improve my patients back home.
This particular course, we've brought people from all over the U.S. together that are actually experts in the field and really focus their practice on the neck. So we have not only the academic component being represented, the research component being represented, and people that mainly do private practice and focus on the neck. So bringing all of those folks together to really give a well-rounded experience about everything that is the neck.
When you have the horse physically in front of you and you have 6 doctors all working together and giving their assessments of what everybody sees, that's huge. That's huge.
My litmus test on this course being a success is for you to be able to go home and utilize everything that we've talked about the first day you get home.
Pathologists, sports medicine, surgeons, internists, it's you know, we're getting input from all different varieties of fields of veterinary medicine, and it's wonderful to get input from all those different areas. So I believe that the areas of expertise that we're seeing here is second to none in my book, of all the meetings I've ever attended.